everyone. I am so fortunate to be here today with Racheal McIntyre, our Memory Care Director at Vista Gardens. She has transformed this department, and I could tell you so many reasons why, but what stands out to me most is her ability to communicate. And a department chair of any department needs to be a good communicator, especially when you're caring for someone's parents or their spouse. And you know, there's just never a way to over communicate, and Racheal is so good at over communicating. And Racheal, have you always been that way? Just you feel like more
always
information?
Been a very big talker. I feel like communication, especially dealing with, you know, the elderly, you have to communicate with families. They want to know everything, so you have to over communicate. No communication, some people say, is good. Not at all. You have to communicate every little thing.
Even on her care report, so we send a monthly care report to families, and they've dramatically changed. Racheal lists many details. She often will include the medication list. She just wants to give more information rather than less, and I really appreciate that. Another thing you do is you make yourself really available to families for your cell phone, your email, whatever way they like to communicate, because not every family likes to communicate on the phone.
Right.
And you're always available. I just don't know how you do it, because you care.
Definitely. And I look at it as if that was my mom or dad, I would want to have access to who is in charge of taking care of them and who's in charge of their care and their overall good health. Right. And I would want to have that availability.
Yeah, you know, and you really do make yourself available. Another thing you do, which I really like, is you communicate quickly and you don't wait for the family to visit. Sometimes it happens, but it's rare with you. I notice like a change in a resident, like say an agitation, you know, or an escalation, and you are right there saying, this is what I think the antecedent is, this is what I think is causing it. And I really appreciate that, and I'm sure they appreciate it.
Thank you. Time is very valuable in our residence. You know, you have to act quickly. You can't wait on something. You can't wait for something to change. Time is a virtue in our community. So
it really is, because you can't get a different outcome unless you make a change.
Correct.
And it seems like otherwise they'll just keep being, you know, the agitation goes on and on and on until the doctor really does make a change, or maybe does something to look into what could be causing it. Usually in our field, it could be caused by an infection. UTIs are a big cause of behavioral changes, constipation, pain, you know, so it could be lack of sleep. Yeah,
so
those are tough, really tough, but I appreciate you always communicating with the families what's going on. And some families literally with her say, you've told me too much. It's too much. And in that case, you know, you realize that family doesn't want to be called as much, but 99% of families want over communication and want to know what's going on, especially if there's a change.
Mm-hmm. Yeah, a lot of our families are grateful if if we call them right away and say, hey, this is what's going on. We've noticed this. We've noticed a behavior change.
A refusal of a shower,
or a medication. Mm-hmm. So they're very thankful.
I agree. Well, thank you for all you do for us. We are so blessed. Thank you, Racheal.